Okay, so again, I'm Bill Cohen. I'm a child psychiatrist at Georgetown. Thank you for this opportunity to speak, and I want to thank all the presenters for your support in putting this together. Um, so my understanding for primary care physicians and pediatricians that you have a very short amount of time to do a lot of activity and a ton of things. And so first of all, in the same vein, I have a lot of things that I want to say. So I apologize if I'm gonna speak kind of quickly. But like in that time, your job is really to try and identify signs and symptoms of psychopathology and then engage the patients in treatment that will be going on for months to years. And in many cases, these are like new onset of chronic illnesses that could be lasting a lifetime. And so, how we help them get engaged in treatment can make a huge difference in their lives. So what I'd like to do now is just give like a very quick overview of a few key points of adolescent development. And these are things that you all know, but it's maybe if I sort of recontextualize them together, it could help get the wheels turning on how to think about patients' experience and help figure out different ways of reaching them and helping them. So without further ado, adolescence is a developmental stage. It starts with puberty and then ends with what we call adulthood. Um, in this phase, there's the greatest maturation of physical and intellectual abilities than any other stage of life. And it's a really exciting, like profound time of development where there's a lot happening. And among active duty families, these are some numbers for the dependents, the current patient population. There's about 207,000 teenagers and 36,000 young emerging adults. And adolescence can be broken down into early adolescence, which is really essentially puberty, pubertal development. It starts, the brain triggers puberty. There's this timed release of GnRH from the hypothalamus, and then that goes down the pathways to, ultimately lead to gonadal development. And then the next phase is late adolescence, and that kind of follows the major endocrine changes of puberty. And that's when there's this really rapid development of in the brain volume and remodeling. And I had this quote from one article in Adolescent Development. I think it's easier read that steroid hormones both remodel and activate neurocircuits during adolescent brain development, leading to the development of sexual salience of sensory stimuli, sexual motivation, and expression of copulatory behaviors in specific social context. So that is, teenagers are getting turned on and tuned into each other. They're like hyper aware. And, this is really about, how do we diversify the population and engage with each other? And it's happening with the development of, the sexual characteristics. But then there's huge psychosocial changes. The social brain develops, and I'm going to speak more to that. Cognitively, we're entering the formal operation stage. Remember, cognitive development, like Psych 101, Piaget. So like mathematics, abstract reasoning, things like that. So then following late adolescence is emerging adulthood. And it's really helpful to look at young adulthood with a developmental lens and realize they're still sort of figuring things out and dependent on adults and each other for, they're caregivers for lots of reasons. And I'll touch more on this briefly. So the adolescent paradox, at this stage, physically, they're stronger, more agile, better coordinated than any other stage in life. Cognitively, their brains are primed to learn, and they really are like sharper with like logic and abstract reasoning. Mathematics skills are like starting to peak. And behaviorally, they're more adaptive and flexible, and like, they're faster, stronger, smarter. At the same time, the rates of mortality in this age increase disproportionately. They're higher risk takers, more impulsive, poor decision makers. Experimentation with drugs, alcohol, criminal activity, unprotected sex, that all goes up. The leading causes of death are all preventable. That's like motor vehicle accidents, homicide, suicide. Um, in 2021, more than 4 in 10 students felt persistently sad or hopeless. About 1 in 3 experienced poor mental health. greater than 1 in 5 seriously considered attempting suicide, and 1 in 10 did attempt suicide. That was like 2021, the thick of the COVID pandemic, when teenagers were homeschooling, and it was a really dark time. But like, if your patients were in high school during that time, 1 out of 10 of them attempted suicide. And we know that a previous attempt now puts them at higher risk for another attempt. And this whole generation really has been traumatized. And adolescence is a very vulnerable time, putting people at risk for later in life problems. So 75% of adult mental health disorders first appear before the age of 24. So this is the time for like prevention, primary, secondary, and tertiary types of prevention measures, to really look out for mental health disorders. Military-connected adolescents, 18% have mental health diagnoses, and they're at higher risk than civilian controls to report depressive symptoms, suicidal thoughts, substance use, and to carry weapons to school. And not just military-connected, but in general, just regarding weapons, it's the teenagers that are shooting up schools, and so that's part of the patient population that we're dealing with. And there's going to be further discussion in this series, so I'm not going to get too involved, but some of the risks of being connected with the military, especially relocation. When kids are changing schools every couple of years, that has a huge impact. And there's also some protective factors that go with the military, as you know. And again, there's going to be further discussion about this, so I won't get into too much depth, but it's important to note that there's just strong social networks and supportive shared values, and access to care. And it was actually found that there's a positive association between family relocation and increased mental health care utilization. So people are seeking mental health support, and there are ways to get them connected. So back to the paradox. I want to talk about adolescent risk-taking and impulsivity. And so first of all, so this is the classic picture, the asymmetric brain development. And when we think about risk-taking, it's distinct from impulsivity. It's associated with sensitivity to environmental incentives, like the sensory-seeking type of behaviors. And impulsivity has to do with top-down control, or poor top-down control, like from the executive functioning. So the classic story is that there's this asymmetry with the prefrontal cortex that develops steadily, like in a linear fashion, into the mid to late 20s. And that's what is in charge of executive functioning and planning, and that's the brakes. And then the limbic system sort of peaks in adolescence and is developing very rapidly. The amygdala grows 7% by 14 years, and then it essentially stops growing. And that's like the emotion center. So it's like, boom, the emotions have just come online. The gas is on, your foot's on the gas, but there's no brakes yet, or they're like slow to really be working. Anyway, I think it's helpful to get a little more in depth about it. It's not quite that black and white. To think about 3 different circuits for motivating behavior is a little more helpful. So the approach system, that's like the appetite of behaviors, the things that are looking for those rewards, like sugar or social media likes, or all the peer pressure and drugs and things that are like exciting and stimulating. And then there's the avoidance system, that's fight, flight, or freeze, and they're reacting to environmental stimuli. And when I talk about environmental stimuli, most of that has to do with social cues and how they're like evaluating each other's faces and their parents and connecting with each other. And don't forget about fawn. That's like the people-pleasing behaviors when someone displays after they've been traumatized. And like, don't be fooled by smiles and compliance. They're hurting on the inside. And then there's the regulatory system. That's like the brakes, the prefrontal cortex that has cognitive control, that can delay gratification. And in my opinion, delayed gratification is really like a marker of reaching adulthood. So the social brain interacts with these circuits, and it's that's the network of brain structures involved in recognizing, understanding, and interpreting social cues from others. The function of the social brain is mentalization. That's when we have cognitive strategies for completing social tasks. So just one example, adolescents, when they're reflecting on, they think about themselves and others more directly, and we can see this in brain imaging. Adults, when they're like empathizing with people, they tend to use parts of their brain that activate like scripts and patterns, but they're taking things very personally when they're thinking about themselves and in relationship to their peers. Like empathy is huge at this age. And they're hypersensitive to social rejection and peer influence. Group norms are valued highest in decision-making processes. Um, the consequences of social rejection are greater than health or legal consequences. That's how, like, someone could feel like a loser for not eating a Tide Pod or something like that.
Bill,
So yeah,
we have about 1 minute, and then we want to have time for some questions for this great content.
Okay, thank you. A couple quick things. So identity versus role confusion is really important. Thinking about like, who am I? And these are the ways that you can connect with patients. And really, that it's a fluid process where they're trying things on. And I think that's your opportunity to like ask them to teach you things about like what's in style or what they're into, their values and behaviors. And like, not to be too freaked out that they're betraying their parents' family values because they're going in one direction. It's shifting. But okay, and then that's the main thing. I guess the other big data point, sleep. It's typical for there to be a sleep phase shift to 1 to 4 hours. Most kids, at least half in the United States, are sleep deprived. Delayed sleep phase disorder is like when they stay up later and then have to get up early. And there's a lot of reasons that I can explain why that happens. Okay, that's the main thing. And then I had some examples, thought if we wanted to discuss screens and algorithms, but I don't want to get into it now. So thank you very much for letting me present. I'll leave this up to think about.